A COVID-19 positive patient from Davis County recovering at home tonight. This after she was Davis Hospital's first novel coronavirus patient and spent time in that hospital when there's still a lot of questions regarding the virus waiting to be answered.
Body aches, horrible cough.
Beginning with bronchitis.
I finally got to where I couldn't tolerate the body aches and just the overall yucky feeling. And I thought, honestly, I had the flu.
Melissa Cox developed pneumonia. She never had a high fever, but needed to be hospitalized with other symptoms. When she told healthcare workers that she had been traveling outside of Utah, she was tested for COVID-19.
I felt like I distanced myself from people, and I used the hand sanitizers, and I washed my hands more frequently and those kinds of things, and I still got it, and I was very shocked.
After testing positive, Melissa was hospitalized for 4 days. As Davis Hospital's first COVID-19 patient, she was able to witness those on the front lines, trying to treat her in the early days of the known virus in Utah.
And I kind of felt like, wow, if they don't really know what's going on, how am I being treated? So that definitely was an interesting experience to have been the first to go through that.
But she responded to the treatment, and as hours and days went on, personal protective equipment and care evolved with the constant stream of new information. For Melissa, the hardest part was being in isolation, away from people, loved ones, those who wanted to know every update.
Because usually, somebody's really sick and you jump on a plane and you go to visit to help, right? And in this scenario, it's no, stay away. That's the best thing for everybody. And that was really hard for them, I think, to understand, is that they couldn't come here and help.
She says she's 75% recovered, struggling mostly with stamina. But now she's a COVID-19 survivor with a message.
I really feel that if people would stay in and stay away and practice that social distancing, that we'll get over this sooner. But the more that they try to say it doesn't apply to them, the longer this is going to go on.
After those long weeks of isolation and self-quarantine, Melissa received a clean bill of health from COVID-19 from her physician. She's a strong believer that while challenging, self-quarantine is necessary to protect others.